Hello, my name is Jim Blando, and I'm an associate professor at Old Dominion University located in Norfolk, Virginia. Today, I'm going to talk to you about a general overview of exposure assessment. And in particular, in this section, we're going to discuss some of the general approaches to exposure assessment that are utilized to conduct exposure assessments. Many methodologies are available and are utilized around the world and in different countries. Exposure assessments are also oftentimes utilized in many different disciplines. This can include everything from qualitative to quantitative approaches. In this discussion today, we're going to focus primarily, though, on the approaches utilized by the United States Environmental Protection Agency here in the United States. So one of the first questions is, how do you select the approach that you're going to utilize to conduct an exposure assessment? And as per EPA guidelines, there are three general overall approaches that are oftentimes referenced when people are conducting exposure assessments. Each of these general approaches has advantages and disadvantages. With that said, it is also important to note that there are many creative methods and ways that these methods and general approaches can be combined. So the approaches oftentimes can be varied and creative. It's not uncommon to have them be a hybrid of multiple approaches. The key thing is that whatever approach is utilized, it must be scientifically valid and logical and documented, by the way. It's important for us to document as well exactly what approach we selected, justify that approach, because that documentation will be important in terms of evaluation, especially by regulatory agencies of the exposure assessment. As stated on the slide, these are not mutually exclusive. Oftentimes we can take some measurements and incorporate them with models and sort of have a hybrid combination of these general approaches. But I'm going to discuss these general approaches kind of in isolation just to demonstrate the overall concept behind each of these general approaches. The first approach, oftentimes referenced by US EPA, is something that they oftentimes refer to as point of contact. This is essentially where you're going to go out into the field and you're going to collect measurements on someone's exposure. In this example, we have a picture of an individual. We were doing an exposure assessment study of dry clean operators who were utilizing a new solvent. In this particular case, you can see in the picture, we have a pump slapped on his hip with a solid sorbent tube on his shoulder, which you can't see in this photo, but it's collecting air basically as he's working with this new solvent to actually measure what his exposure might be. In this particular case, as in the picture on the slide, no data was available on this process at the time that we were doing this study. Essentially, what happened was we got a call from the Poison Control Center, had an individual who had been poisoned by this new solvent, was experiencing neurologic symptoms. The Poison Control Center thought it might have been related to this new solvent, but because no exposure data was available, we had no way of estimating what those exposures might be, and this resulted in us in conducting several studies for us to understand what those exposures may be. And we utilized the point of contact approach because in this particular case, we were not sure what the pathways of exposure might have been. We had no information on this new solvent. We didn't know if the solvent was dermally absorbed and so forth. So we went out and said we have to actually go and get some data and measure some of these exposures. In this particular case, this was this new solvent, 1-bromopropane. In this particular example, we're assessing this individual's exposure via inhalation. So what are some of the advantages and disadvantages of using a point of contact approach? Well, oftentimes when you go out and actually collect samples, not only do you have the expenses of collecting the sample, but you also have the expenses of the analytic chemistry that is needed to actually analyze your samples. So one of the disadvantages to utilizing this point of contact approach can be that it's oftentimes expensive. However, one of the advantages is that it can give you a representation of real life exposures, especially when there's no data pre-existing on what those exposures might be. It is specific to the specific sampling event, so it's specific to the period of time that you're actually collecting your sample. Your goal is to make sure that if you go out and do sampling, that sample is representative of the overall exposures people have, but that's not necessarily a given. You have to assure that your sampling is representative. One of the advantages of utilizing this approach is it does give you some very solid data points, actual measurements, or hard data, as people oftentimes refer to it. Again, as we've already mentioned, it's useful when clear assumptions are not available. Typically, one of the disadvantages, because of the expense and resources involved, oftentimes the point of contact measurements, you're somewhat limited in the number of samples that you are able to collect. And consequently, fewer samples could potentially mean fewer or lower representativeness of real life situations. So that's always a concern. Do I have a large enough number of samples for me to actually have a good estimate of what the exposures might be? In scenario evaluation, which is a second general overall approach oftentimes described by US EPA, essentially what we do here is given exposure samples are modeled utilizing computer models, but they may also utilize some pre-existing data as well to prospectively predict or predict going forward what we might expect in the future. If pre-existing data is helpful, that may help us build the specific scenario that we might want to model. And this may help us then utilize those models to estimate what the exposures might be by utilizing some pre-existing data as well as utilizing various models to predict what that might be in the future. An example of where scenario evaluation can be very helpful is if I have a product like that lawn care product that is not out on the market. So since it's not yet out on the market, I can't go out and measure exposures because no one is using it yet. However, I might be able to take some data and take some information about how I would expect people to use a product and then make some future projections of what I think those exposures might be by utilizing these models, which may then give us some information and data about whether this product should be released to market or allowed to be sold in the market. So scenario evaluation is where I look at a given scenario and how I expect the product to be utilized, make some predictions of what the exposures might be in the future, which can then be helpful in terms of making a risk management decision about whether this product should be allowed for sale in the general US market. Here's an example looking at specific scenario evaluation. You can see here, this is a schematic on the right of a individual working in a facility where they're doing an electroplating operation, where they're dunking materials into a bath and allowing them to be coated with various metals like chromium and so on. The company in this example wants to utilize a new electroplating agent in its manufacturing process, but before they do so, they want to get some estimates about what the exposures might be if they add this new product. In this case, one could utilize various models as depicted here in the schematic to estimate what the exposures might be to individuals working so that the company can make a decision about whether they should utilize this new product. In this case, you have very sophisticated models such as near field and far field exposure modeling, depending on how close you're standing to the electroplating bath. And these models can be utilized to help make those types of decisions about whether this new electroplating agent should be used, whether the exposures might be significant in this particular scenario. What are some of the advantages and disadvantages of utilizing a scenario approach? Well, they oftentimes can be more timely and practical because I can utilize computer models to help do these estimates of the exposures people might have. So they can be timely and practical and sometimes will be less resource intensive and hence less expensive. However, some of the disadvantages of this scenario approach is that oftentimes you have to make a lot of assumptions in order for me to put together a good computer model. And the question always becomes, are those assumptions realistic? Are they representative of what someone's going to actually experience out in the environment? Oftentimes, it'll also generate a significant amount of data points, which is a consideration because it does take staff time to evaluate all the individual data that can be generated. So that can be both an advantage, but at times can also require some resources as well. But generally speaking, scenario evaluation is a situation that oftentimes can result in more rapid results and estimates. Then if we go to the third approach referenced by EPA, reconstruction of exposure and dose, this oftentimes can involve the evaluation of pre-existing point of contact data, data that may exist, measurements taken in the past, may also involve modeling, utilizing models to go back in time and to estimate what the exposures may have been. The key thing here is oftentimes past experiences are retrospectively reconstructed to provide estimates of what past exposures might have been. This may utilize models, sometimes may utilize pre-existing secondary data to make those estimates. An example of this would be when we conducted the Toms River Pediatric Cancer Study. This was a study that we did where there was elevated rates of childhood cancer in a given area in Toms River, New Jersey. There was concern about could these exposures have contributed to the risk of cancer in the children in that town where we saw these elevated cancer rates. However, the concern was about exposures that occurred in the past. Before the study could be done, it was important for us to be able to develop estimates of what the exposures might have been. In order to do that, we had to go back in time and actually utilize computer models and pre-existing data to actually try to estimate what exposures might have been in the past. So, for example, there was concern about industrial sites and air emissions in the past. We were able to get meteorologic data for past time periods, but there was no emissions data. but we're able to utilize past meteorologic data and air dispersion models to estimate what the exposures might have been in the past, which then helped us do this retrospective cancer epidemiology study. So we can utilize both modeling and secondary data from past sampling to help us reconstruct what we think the exposures and the doses that people may be receiving in the past to help support those types of retrospective studies. You may notice that biomarker data sometimes can also be helpful. This is where we may utilize data on blood or urine samples are the most common for us to estimate what someone's exposure might have been. A really classic example of this would be lead in construction. You have construction workers working with lead paint. If I were to take a blood test from those workers and send that off to a lab, I could measure how much lead is in the worker's blood, and that would oftentimes be representative of the exposures that they may have had within the last 30 days. There are some guidelines that exist by the OSHA lead standard that would look at those blood levels and make determinations about what should happen to those employees with regard to their exposures. But that's sort of a very classic example. The utilization of biomarkers has expanded quite substantially in recent years because of improvements in biotechnology. But this is where I can utilize biomarkers to assess current but also past or recent exposures as well. Some of the advantages and disadvantages of reconstructing exposures is that it can really significantly support retrospective epidemiologic investigations. One of the significant disadvantages that can occur is that sometimes exposure misclassification can occur fairly easily, especially if pre-existing data quality is low. This is true even when you're doing modeling. If you have limited data that you can input into your model, that may result in poor or imprecise model estimates. And again, similarly, this would be specific to the specific scenarios that were evaluated. So it's interesting because EPA makes the following statement on the slide listed here that's essentially saying, even if you use different approaches, you should essentially get the same result. What I can tell you is that in reality, because these exposure assessment procedures and methods are essentially a tool to help us understand, it's not a perfect rendition of reality. They're a tool like many of the tools that we have. So in practice, you will typically see that if you do use different approaches, you will see variability in the results that you get. So the question, do you think the estimate will be the same irrespective of the approach taken? While theoretically, I could understand why someone might make the claim that theoretically they should be the same, in reality, because these are tools and they're not perfect, oftentimes you'll see variability in the results. This is why it's important when we're planning our exposure assessment for us to carefully consider how we're going to do it and pick the best approach that we believe can give us the most precise and accurate estimates possible. When we think about the assessment plan and establishing an exposure assessment plan, this obviously should be something that's well documented. It's not uncommon for you to conduct exposure assessments and many years later get a question about that exposure assessment that you may have done many years prior. This is especially true if there's a request for retrospective epidemiologic studies where someone wants to know what are the exposures that someone had many years ago and how does that relate to their adverse outcome they're experiencing today. So exposure assessment plans have to be very well documented. And this is listed here in the EPA guidelines is quoted on this slide. Obviously, we want to document all of the things that we've talked about. It's important for the purpose, objectives, the scope, how much detail, the level of detail, and the approach, how you're going to do the actual exposure assessment. This all has to be very clearly delineated and defined and documented. Sometimes this will involve stakeholders. Sometimes it involves peer and expert review, especially if it's a very high-profile case. And sometimes outside comments are solicited, especially if there are EPA assessments that are being done. So to summarize, exposures can be evaluated in many different ways using multiple methods. The standard general overall approaches include point of contact, scenario evaluation, exposure reconstruction. But as we've already mentioned, oftentimes you'll find some hybrid of these approaches that are utilized. The key thing is for them to be scientifically valid and justified in the approach that is taken. A thoughtful plan driven by the overall purpose and objective of the assessment is key to selecting the proper approach. Thank you so much for your attention in this particular section, and I look forward to working with you on other sections of this course.